Hello students, today we will discuss about level of prevention. What do you mean by levels of prevention and how we will knowing at which level we are preventing the disease. In this video we will see. What do you mean by prevention? Prevention means if the person is not having the disease condition, we are preventing so that in the future life the person will not get the disease condition. So in level of prevention, we are preventing from the disease condition. We are restoring the health of an individual and we are promoting the health of an individual. So this is the meaning of levels of prevention. There are 4 levels of prevention. The one is primordial level, second is primary prevention, secondary prevention and tertiary prevention. What do you mean by primordial prevention? Primordial prevention means the person is not having any disease condition, no risk factor. There is no risk factor, no disease condition. Even though we are preventing the persons to get into the disease condition, that is primordial prevention. It includes 2 strategies. One is individual education and mass education. Individual education means to a specific individual we are providing health education or education regarding to prevent the risk. And in mass education, through the media, TV, radio, we are educating the public. In primary prevention, the person is at the risk factor but there is no disease condition. So we have to prevent the disease when the person is at risk. In primordial, there is no risk. In primary prevention, there are 2 strategies. One is health promotion and specific protection. In secondary prevention, the person is having the disease condition and we have to provide the treatment. To identify the disease condition, we have to make the diagnosis and some tests should be performed. So secondary prevention include early diagnosis and treatment. And tertiary prevention include disability limitation. That means the person has taken the treatment but the disability we have to limit it so that the person can able to perform the activities of the livelihood. And second is rehabilitation. So these are the 4 levels of prevention. Now we will discuss one by one in detail. First we will discuss what do you mean by primordial prevention. Prevention of emergence or development of risk factor, that we have to prevent so that the risk factor will not develop. It is a pre-pathogenesis phase and special attention is given to prevent the chronic disease. For example, hypertension is occurring in the person who are obese. So we have to teach the person that obesity may lead to hypertension. That's why the person who are obese, teach them to reduce weight. Discouraging people to adopt harmful lifestyle through individual education or mass education. So this is primordial prevention. There are some examples of primordial prevention: national program and policies on food and nutrition, comprehensive policies for discouraging smoking, alcohol and drugs, promote regular physical activity and lifestyle changes. So these are the examples of primordial prevention. Now we will see what do you mean by primary prevention. Primary prevention is action taken prior to onset of disease, before the disease condition occur, the action that we are taking so that the disease will not occur. So that is primary prevention. That means person is at the risk factor that the disease may occur, but we are trying so that the disease will not occur. Intervention in pre-pathogenesis phase of disease or health condition. Primary prevention include concept of positive health. This is one of the question that is asked in the competitive exam. Concept of positive health includes in primary prevention. What do you mean by positive health? It encourages achievement and maintenance of an acceptable level of health that will enable every individual to lead a socially, economic, productive life. That means each and every person can able to live a socially and economic productive life. So that person can able to perform the activities. There are two strategies that are included in primary prevention. One is health promotion, second is specific protection. Health promotion includes health education, environmental modification, nutritional intervention, lifestyle and behavioral changes. Whereas specific protection includes immunization and seroprophylaxis, chemoprophylaxis for the cancers or the person who are at risk of getting cancer, use of specific nutrients and the supplement. For example, vitamin A supplement is given to prevent night blindness, safety of drugs and food, control of environmental hazard, for example, air pollution and water purification, contraceptive methods, quarantine, hand washing, mosquito repellent cream or net, and prevention of road traffic accident. These are included in specific protection and included into the primary prevention, having two aspects, health promotion and specific protection. Now we will discuss the secondary prevention. What do you mean by secondary prevention? Action which hold the progress of disease, the actions that we are using so that the disease will not progress further. It includes three things. One is early diagnosis, treatment and referral. Early diagnosis includes screening test. Screening test में breast self examination, testicular self examination, pap smear test, any radiographic examination like X-ray, CT scan, MRI, urine examination for diabetes, and laboratory test. These are the included into the early diagnosis. And for the treatment, the person is getting any medical and surgical treatment, oral contraceptive for PCOD, psychotherapy, any treatment that the person is getting, that will be included into the secondary treatment. The question that is asked, that screening test is at what level of prevention? That is at the level of secondary prevention. Sometimes question from pap smear test is also asked in the competitive exam. And referral, if the facilities are not there, person can be referred to a high level of facility. Now we will see what do you mean by tertiary prevention. All measures that are available to reduce or limit the impairment. The person is taken the treatment so that the limitation for the impairment or the disability can be made and the health of an individual can be promoted. It includes late pathogenesis phase, whereas secondary prevention include pathogenesis phase. Pathogenesis means when the disease is at the peak level. So the disease is there, the condition is there may be impairment, disability, and the person may get handicapped. So we have to prevent the person will not get handicapped, or there should be limit disability. The specific intervention for the tertiary prevention are disability limitation and rehabilitation. Disability limitation includes impairment, disability and handicap. These are the three definitions we will discuss in this. What do you mean by impairment? Loss or abnormality of psychological, physiological or anatomical structure or the function. If there is any loss to any organ, either it will be anatomically or the function is not working properly, or the person mental is not strong, so it will lead to impairment. What do you mean by disability? Disability means there is restriction in performing the activity. What do you mean by handicap? Disadvantage given for an individual resulting from impairment or disability that limits so that the person cannot able to perform the role whatever the person can have to perform. There are some example of disability limitation. For example, use of crutches in polio, physiotherapy and prosthetic after amputation. These are at the level of tertiary prevention. Now we will see what do you mean by rehabilitation. Re means again, habit means for the livelihood of an individual, we have to make the individual so that the person can able to do function properly to the highest level. The combined and the coordinated use of medical, social, educational and the vocational measures for training and retraining the individual at the highest level of functional ability, so that person can able to perform at the highest level. It includes medical rehabilitation, vocational rehabilitation, social rehabilitation and psychological rehabilitation. Medical rehabilitation include restoration of bodily function so that the body can able to perform the function. Vocational rehabilitation for the livelihood, for any vocation or job. Social rehabilitation for the family and the social relationship. And psychological rehabilitation for the personal dignity and the confidence of any individual can be maintained. There are some examples of rehabilitation: establishing school for the blind, exercising in neurological disorder, and reconstructive surgery in leprosy or some other disease condition. So in this video we have discussed about the level of prevention, at which level how we can able to prevent the disease condition. Thanks for watching. Do like, comment, share and subscribe my YouTube channel for more videos. Stay tuned with me. Stay safe, stay healthy. Thank you.